Let's queer up health. American Psychological Association stands against bans on gender-affirming care for trans youth. The American Psychological Association has issued a groundbreaking policy resolution opposing bans on gender-affirming care for transgender youth. With 157,000 members, the APA asserts that such bans disregard crucial psychological and medical research. The policy passed with an overwhelming 153-9 vote and underscores the necessity of gender-affirming treatments for transgender individuals. This move represents a significant consensus among leading psychologists in the importance of such care. President Cynthia de las Fuentes emphasizes the importance of the new policy resolution, highlighting the positive effects of gender-affirming care on transgender, gender-diverse, and non-binary individuals' well-being. The policy highlights the need for individuals of all ages to have access to comprehensive gender-affirming health care. It also condemns state bans on gender-affirming care, emphasizing that such policies contradict evidence-based healthcare principles, human rights, and social justice. It also denounces misinformation by equating gender dysphoria with trauma or neurodivergence. The policy comes amid claims made targeting such care. Representative Gary Click of Ohio attributed the rise in transgender individuals coming out to autism to justify a ban on care. Similarly, Pamela Paul's recent New York Times piece suggested neurodivergence and OCD could cause gender dysphoria. The APA policy strongly opposes these ideas. And once again, the APA is at the forefront of making these decisions. They were the first to come out against a treatment like what was the gay reversal treatment?
Right.
I forget. Yeah, whatever. And it's not just about where to put a comma and where to put a period. It's really about the science of psychology and what the experts believe and know. Good for you.
And I can tell you, I know plenty of people with OCD and, people with autism who have no gender dysphoria at all whatsoever.
Not a one.
And I know some transgender people who are not OCD, nor do they have autism.
Mm-hmm.
It's just a ridiculous, statement made by people who don't know.
The point is, the reason that you're seeing more people coming out is because they're no longer afraid of your bullshit.
Right, exactly.
So instead of hiding from whatever it is you're trying to oppress, people are standing up and saying, no, I'm going to be me, and I'm okay with that.
Yeah, if it's hollow, it will crumble, like I stated on the previous story. If the ban is hollow, if it's based off of nothing, if it's based off of ignorance, it will crumble before your very eyes, and you will get humbled. It will take us a while, and it will be scary in the process, but it will crumble, and you will be humbled by this.
And again, to that point, our gender-affirming care ban for minors and the one that restricted, Medicare and Medicaid coverage for gender-affirming care, both enjoined in the courts, right? Like we are seeing before our very eyes all of these things crumble down because they're just not based in reality. They're, all of these things about gender-affirming care or transgenderism being a moral contagion and all of these other things are just not true.
Nope.
And I think it's so important that we're able to see this firm stance from the APA, that we're able to see, folks that are espousing these ideas backed by science, and really showing what the facts are.
That's correct.